Welcome to another special election edition of Go Vote Omaha, presented by the League of Women Voters of Greater Omaha. I'm Jerry Simon, a League member and host. This program, we're going to talk about Ballot Initiative 427, or better known as Expanding Medicaid in Nebraska, which you'll see on your ballot this November 6th. And to talk about the Medicaid expansion proposal, ballot initiative, we have Mary Spurgeon, who's with Omaha Together One Community, or commonly known as OTOC, and she's the co-chair of the Healthcare Action Team. Welcome, Mary.
Thank you very much, Jerry. Thank you for inviting OTOC to be here.
We're glad to have you. First of all, we do want to let our viewers know that the League of Women Voters is supporting this Medicaid expansion proposal that's on the ballot. So we want to put that disclaimer out there right up front before we continue talking about the ballot proposal. Before we get started, tell us just very briefly, what is OTOC, Omaha Together One Community?
Omaha Together One Community, abbreviated OTOC, is an organization of congregations and other groups who share a commitment to work for the common good. We want to build a strong America in which there is mutual responsibility for effective government, to create broad prosperity and a better future that doesn't leave anyone out.
Okay. All right, well, let's get right into the ballot initiative. There have been several attempts in the unicameral to pass Medicaid expansion. They've all failed. But now enough signatures were gathered to put it on the ballot and take it to the voters. So we want to throw up a graphic on the ballot language that voters will see on their ballot this November 6th. And tell us about what the language is. What does a for vote, which is a yes vote, or an against vote, a no vote, what does that mean?
Well, this language is almost exact. It was just ripped from the petition language that was required for all signature gatherers to read to everyone before they were invited to sign the petition. So it simply says that the Medicaid state plan will expand eligibility to cover certain adults, ages 19 through 64, whose incomes, and they use the term 138% of the poverty level, which goes over my head, but essentially it's people who are making less than $17,000 a year.
Okay.
They're living the dream on $17,000 a year. And this is defined by law, actually, in the Affordable Care Act. And this also goes on to say that Nebraska shall maximize its federal financial participation in order to fund the care of these people.
Okay.
And as you said, if you're for it, if you want to say yes, you circle the for.
Right.
And
the
against
bubble
if you're
there,
opposed.
and against you,
Right.
you circle the other one. Okay. Other than expanding coverage and basically eligibility for people, does this change anything else about Medicaid in Nebraska?
It does not. To talk a little bit about what I call traditional Medicaid, just to differentiate it, the Medicaid program has been around for 50-some years, and it is a state and federal partnership. Essentially, the state pays 50% of the cost, and the federal government pays the other 50%. So it's very much a partnership. You cannot just be a poor person and get Medicaid. You also have to fit into some eligibility groups. Children, okay, who are in families that earn below a certain amount of money, a pregnant woman in a family earning a certain amount of money, and I can give you those children in families that earn less than $3,689 a month.
Okay.
And pregnant women, it's about the same, a little bit less. If you're a parent of a child with a very low income, that is earning less than $1,005 a month, then you would qualify. If you're a senior earning less than $1,732 a month, you would qualify. Or if you were a person with a disability earning less than $1,732 a month, you would qualify. But that's traditional Medicaid, and expanding Medicaid does not affect it. People who qualify for those will still be covered under those terms.
And it's important to recognize too that for a lot of people, they think maybe they don't know someone who's on Medicaid, but if they have a senior in long-term care, eventually that person has probably gone on to Medicaid to help pay for their care.
Yes, and that's I think one of the largest chunks of Nebraska's traditional Medicaid outlays.
Okay.
Yeah.
Now, are veterans covered at all on
Not
under
to my
Medicaid?
knowledge.
Okay.
No.
Okay.
They are not.
And then the other question about Medicaid is that Nebraska pays half, the federal government pays half for traditional. Do the recipients of Medicaid pay anything toward their care?
You know, I don't know the answer to that. I heard a speaker just today say that Nebraska has the Cadillac version of Medicaid, meaning that it pays for 19 kind of ancillary services like physical therapy and things like that. So it's possible people might be asked to pay for that. I'm not sure. I can't answer that question.
Okay. Well, we have another graphic that we wanted to put up on the screen for you to talk about. It's calling it the umbrella graphic. And do you want to talk about that one? It's it looks at specific groups and then Medicaid, the gap of no coverage, and then subsidies.
Certainly. Well, on it would be the right side of the screen, those are people who earn enough money to qualify to buy coverage on the marketplace exchange. Okay? If they earn $1 less, they fall into the no coverage gap. And as I explained, Medicaid is limited to specific low-income groups, so they are covered there. But it's the folks in the middle, and these are primarily working people. 60% of them are working people, 1 or 2 jobs, but they earn low wages, and they work for employers who do not offer health care insurance, or they don't offer affordable health care insurance, because they might say, oh, here's a health care policy, it's $500 a month, and by the way, there's a out-of-pocket every time you visit the doctor, and you have to meet a certain deductible, and that's just not possible for people who are in low-wage jobs.
Right. Okay. So if we expand, obviously there are people in the gap who can't get on traditional Medicaid right now, and the biggest reason for that is?
The constraints of traditional Medicaid. They just don't qualify. They are not a pregnant woman or a child or an elder or someone with a disability.
Or they make too much money.
Or they make too much money. Yeah.
Okay.
Exactly.
Even though they're not making very much.
Exactly.
It's too much to qualify under the current.
And oddly enough, not enough to qualify for the subsidy on the market, healthcare marketplace.
Okay.
Yes.
Okay. So let's talk about what expansion then would mean. Who would now be eligible?
Well, this primarily would be adults between the ages of 19 and 64, you know. At 65 they can roll on to Medicare.
Right.
But even if they make 0 income, they can't at this point in time. And it would also help parents who earn too much to be in traditional Medicaid, but don't make enough money to qualify on the exchange. And it can be just $1 difference, and they're in the gap. Yeah.
So a whole family now could be maybe before their children, they could have their children on it, but now they can be qualified and have coverage for themselves.
Exactly.
Okay.
Exactly.
Okay. And then we just talked about health care for workers without an employer-provided insurance. So that would be a lot of people.
That's about 60,000 people, we estimate.
Okay.
And you know, so what about the other 30,000? Hard to tell. Maybe there are people who are staying home to care for someone who's ill, maybe an elder. I'm thinking there are people out there in the state who have said, I can't work a job, I have to stay home and look after my father, or I have to look after a sick child. And I don't think anybody who's ever done that would say they're not working, but they're not getting an income.
Right.
So that's a stressor, additional stressor on the family.
Okay. And I think there was a study done, we wanted to talk a little bit about, that looked at what are the top 5 occupations worked by Nebraskans who are in that coverage gap. And it's pretty interesting. So do you want to talk about those particular jobs?
Yeah. That research indicated that, probably not surprisingly, 11% of that number are food service workers. So, you know, you can check that out when you go out to eat, ask your random waiter, do you have health insurance? And see what answer you get. But by and large, that's a big portion of it. Also, office and administrative support staff, retail sales, shopkeepers, storekeepers, construction, which is very seasonal often. And so they work like dogs when the weather's good, and then they don't work and no income's coming in, and if their employer doesn't offer insurance, then they are in the gap. And then, of course, cleaning and maintenance, the people who clean the motel rooms and the office buildings, and maybe are their own private contractor to do that with an employer, and they're in the gap.
Okay.
Yeah.
One other thing that has been talked about before with expanding Medicaid is that one of the benefits of it is that it would create and sustain jobs. And do you want to explain how that would work with expansion?
Sure, a couple of ways. As far as job creation, we're not, we can't point to exactly where it might go. But with that money coming in to provide health care, we can say that there would be more people employed in that field to supply that care. And when people have more disposable income, and people making $17,000 a year or less, they spend all of their money. So all of that would wind up going through the economy more than once, and really create some fire.
Okay. Well, 33 states currently have expanded Medicaid under the Affordable Care Act since 2014. We could have done it back in 2014, didn't. Maine recently, it was one of the most recent with a ballot initiative also, and then this fall, Idaho and Idaho and Utah also have it on the ballot with Nebraska to expand it. What do we learn, what do we know from the states, the experience of the states that have expanded Medicaid? What have we learned why it would be good for Nebraska to do this?
Yes, I think so. First of all, no one says, take it back, we don't want it. So that's instructive. And there has been enough research since it wound up, for people who do that kind of research, Kaiser Health and so forth, to say there has been better health outcomes in states where it has been expanded. And it has also helped stabilize institutions, other institutions there, such as in Nebraska, it would be our elder care facilities in rural parts of the state. Rural hospitals would be affected by this, would be helped. It's also relieved pressure on state budgets and county governments. Budgets as well, because all of those have a line item to pay for people who are indigent, who cannot pay for their care, and so that's what Medicaid expansion is designed to do, is to help cover that.
So states have found that it's really saved money in the long run.
They have.
By expanding it. Okay, rather than their Medicaid program costing more, they're saving some money.
And part of the reason they're saving that money is because when people have access to care, and because we're very proud people here in Nebraska. Nobody wants to say, I don't have insurance and that's why I can't go to the doctor. So they put it off and they wait until they're really, really sick and desperate, and then they go to the emergency room. And it's very well known that that is the most expensive place to seek care. And a lot of it is because people seek it when they are so sick that they may not leave the hospital.
Right. And the other thing, part of that would be that if you have people who now have access to health care coverage, insurance coverage for it, they're going to be healthier. It'll be a healthier workphorce. That benefits employers and the state.
Absolutely.
So it benefits everyone.
More productive people. There's a phenomenon called presentism, where people come in sick, and they're present, but they make mistakes. They give everybody else their illness. They don't want to be there. So there's loss of materials. I mean, it's very significant. So we'd be more productive citizens.
And that's been found in other states that have expanded as well.
Oh, yes.
Okay. Then we get to how much would expanding Medicaid cost? So let's talk about the federal subsidy for expansion. How much of the expansion cost would the federal government pay? We're already paying half of our traditional Medicaid.
Correct.
And we've got a graphic that we want to throw up there about federal dollars. So talk a little bit about that.
Well, under the traditional, what I call traditional Medicaid, it's a 50-50 partnership. Under Medicaid expansion, the federal government pays 90% of the cost, and the state picks up 10%. Now, at the beginning when this was rolling out, the federal government picked up 100% of the cost.
And that's till 2020, correct?
No, actually. Nebraska missed that window.
Okay.
And I can't remember the year when it started to go down, but we missed that. If we had voted to expand earlier, we could have had a year of that at least. So it goes down by a couple of percent each year until the bottom reached is 10, or the height, I guess. 10% is the most that the state will ever pay under this law.
Okay.
It will not continue to go up.
Okay.
10% is the most.
So our federal, I mean, we paid tax dollars that Nebraska was missing out on receiving to expand Medicaid since 2014, because we didn't agree to do that.
We have. OTOC's research says that we missed out on $362 million per year. And that, as you say, Nebraskans have already paid that in. That will support now elder care facilities, clinics, and hospitals around the state. One of our leaders went to her hometown. It was in Boyd County, and she's in healthcare, and she talked with relatives there. That small hospital has lost $1 million during the first few months of the year. I think this was through May. And they cannot eat that kind of loss forever. So they shift the costs to someone else. That's why we have $6 aspirin charges at hospitals, things like that. Or they let people go. There was one less social worker at the hospital after that, because they just could not afford to keep up the staffing that they wanted to keep.
Okay.
So it hurts those hospitals.
So what do we say to the argument the person said, well, it's still going to cost the state more dollars because we have to cover 10% of the cost at this point?
Well, most states have found that actually they get savings when they enact Medicaid expansion. And part of it, the reason for that is we are inefficient. We have a patchwork of coverage. We have this traditional Medicaid, it covers some people, and then we have some other coverage like for people in prison, and then we have a behavioral health thing for this group, and then the county covers a few people here and there, the county budgets. But it's a hodgepodge. And by leaving people out, we're paying for it anyway. If you have a health insurance policy, $1,000 a year added to that policy to cover because of the cost shifting that's happened with hospitals. Because hospitals, their patients pay more, and then they say, well, insurers, you got to give us more for this stay. So we're already paying for it, and there are efficiencies to be found. One of our leaders in this action team did an analysis, actually, and according to his analysis, it was that the match for the 10% match for Medicaid expansion would be like $22.3 million, which isn't chicken feed.
No.
But in the state's general fund, they have a $34 million fund for state disability payments, a drug program for HIV and AIDS patients, for prison health, and for behavioral health. So let's just take that 10% out of that line item, and we've already saved about $13,000.
Because some of those, the treatment for a lot of those conditions would come under Medicaid.
They will come under Medicaid expansion. So you use our 10% for what you were already going to use that for, and the rest is taken up by Medicaid expansion.
Well, what about, there's another argument out there that we can't do this, or we shouldn't do this, because we can't rely on those federal dollars being there. Now, so how do you answer that? I mean, we're already been relying for years on 50% of our traditional Medicaid coming from the feds, and we don't worry about federal transportation dollars.
That's exactly right. We do not. We always accept the matching funds from the federal government for roads and for education and things like that. So why this is a different program, it beats me. I can't answer that question. There are other states, people who move here from other states. A gentleman from Kentucky the other day, he'd not lived here very long, he says, you haven't expanded Medicaid yet? what's wrong with you people?
Okay.
Because
and Kentucky being one of the states that
did it very early on.
Yes.
Very early on.
Okay.
So.
Well, one of the other arguments that you hear is, oh, it's going to cost much more than that. It will cost the state much more. So what's the answer to that argument?
From what I have read, in some of the early states to expand Medicaid, they expected that to happen. It actually did not happen because there were not that many new enrollees. The state was already paying for folks like people who had behavioral health needs or corrections or that sort of thing. So each state government's estimate was really pretty spot on, and it didn't expand a lot.
Okay. So that kind of a fear tactic.
Yeah, I think so.
Raising costs.
You know, and Jerry, look, 33 other state legislatures have figured out how to do this. You know, we have good business people in our legislature, and I mean, I have confidence in them that they're going to be smart enough to figure this out. That's kind of where we're at.
Okay. A question we always know that voters, I think, and taxpayers want to know is, will this proposal, if I vote for it, is it going to make my state taxes go up, my Nebraska income tax? Is it going to go up?
I can't imagine how it could, because we are already paying for care for people in the most expensive, inefficient way possible. And when you get a 90% inflow of money to your 10% match, you'd have to work real hard to make that happen, I think.
Okay.
I think you would. Yeah.
Okay. Another thing is that I think it helps people understand the need better when they can kind of relate to maybe someone they know or a story, or they hear about someone who maybe couldn't qualify before for Medicaid and they really need it. So can you give us any examples in particular that you might have of people you've run into that it kind of brings to life the need?
Well, I have run into people when I was collecting signatures. I was a real high wage earner on there. You could you know, what is 0 times a million? I can retire on that. When I was collecting signatures, I ran into parents who had children, adult children who were in the gap, for whom they were concerned. I remember in a neighboring small town, a young woman, or a woman, who was working in a bakery, and I invited her to sign and explained what it was about, and she said, "Oh, that's me." And I would guess she was between the age of 50 and 65. So, you know, there are people everywhere. I also recently heard a story from a young woman who had acquired a brain virus, and it left her really disabled. And she has since overcome all of that, except it left her with a speech disability. When she gets nervous, she's hard to understand. She has training as a medical coder, and some bills paying off, education bills still to pay off for that. But she can't get a job because she interviews over the phone and she doesn't come across well, no matter how talented she is. She is effectively boxed in and prevented from working her way out of poverty, because if she makes too much money, she falls out of her health care. And I've heard from other disabled people, they are really stuck.
So for the person who says, well, I want people to work to get benefits, here's a good example.
Exactly.
If we expanded Medicaid, she could possibly.
She could be more productive. She could pay more taxes. She could, have a job that she's qualified to do.
Okay.
Right now she's doing home health work and earning, I don't know, $13 an hour.
Yeah.
So
not a living wage.
Not a living wage.
So what will happen if it doesn't pass?
Well, I suppose we'll continue to pay for those people in the gap, and we will cope with the 500 lives per year, which it's estimated have been lost because we haven't expanded Medicaid, and that comes from some research that the University of Nebraska Medical Center did and was cited in a journal. We will have more bankruptcies, which cost the entire community. We will miss out on having funds that will help stabilize our rural hospitals. Our rural towns need all the revitalization that they can get. So there's a lot of things we'll lose out on.
Okay.
What will happen after that? I don't know.
Okay.
It's to see.
Well, it's not just OTOC and the League of Women Voters, but other groups are supporting Medicaid expansion. In this last couple minutes we have, you just mentioned who else, what other groups and people are supporting the proposal to expand Medicaid.
Well, I counted 25 on the list right now. So would you like me just to read through
You can
them?
run through them real quick if we can.
Well, AARP of Nebraska has been involved in this for many years. ACLU of Nebraska, the American Cancer Society Cancer Action Network, the American Heart Association, Brain Injury Alliance of Nebraska, the Center for Rural Affairs, Central Nebraska Peace Workers, Children and Family Coalition of Nebraska, Community Action of Nebraska Incorporated, and they have health clinics around the state, Friends of Public Health, the Health Center Association of Nebraska, Heartland Workers Center, League of Women Voters of Nebraska, as well as Omaha, Multicultural Coalition of Grand Island, the National Council of Jewish Women, Nebraska, Nebraska's AFL-CIO, the Nebraska AIDS Project, Nebraska Appleseed, the Nebraska Association of Behavioral Health Organizations, the Nebraska Association of Local Health Directors, the National Association of Social Workers, the Nebraska Hospital Association, the Susan G. Komen Great Plains chapter, the Leukemia and Lymphoma Society, and Voices for Children in Nebraska.
Okay, so lots of medical, particularly focused organizations, other nonprofits and public policy
And
organizations.
people interested in healthcare for vulnerable people.
Okay. Well, we're going to put a graphic up on the screen. If anyone wants more information, it tells your website, and then there's an accountability session. Do you want to mention that?
Sure. Omaha Together One Community is having a candidate accountability session on October 22nd. It's at First United Methodist Church in Omaha. It's on Cass Street, just north of the Playhouse. At that session, we are going to ask candidates for the unicameral from legislative districts 6, 8, 12, and 20 to answer questions about the issues that OTOC is working on. We don't endorse candidates. We want all the candidates to say yes to our issues, and our issues are housing and mental health, Medicaid expansion, environmental sustainability, and payday lending. So those are the questions we'll pose to them.
But people can get information about the expansion, definitely.
Sure, they can,
Okay.
and the Ensure the Good Life is the campaign headquarters.
Okay.
For that.
Well, we're going to throw up our graphic vote for 427.
All right.
Thank you so much for being here.
Well, thank you
Appreciate
for
it.
allowing me to come.
Thanks.
Appreciate being
For
here.
the League of Women Voters, I'm Jerry Simon, reminding you to inform yourself about the issues. And on Tuesday, November 6th, go vote Omaha. We're good. Yay!
Good.
Well done.
Well,